plank. So we did a post where we were describing the biomechanics of the plank and why the glutes are not working in a plank, and then we got all of these questions, and I can see that there's huge confusion. And then we were given some study about, no, the glutes are activating in the plank, and I was like, I want to see that person planking and getting strength in their glutes in the plank. Let's not talk about a plank that you hold for 10 to 15 to 20 minutes, because then everything's going to kick in. It's like playing rugby. The more you hold it, the longer you're there, the more the body goes, give me more, give me more, give me more, to actually hold the position. But to activate glutes to get you up into a plank, not necessary. I want you to try and understand exactly what changes, what joints change in order to get you to the plank and where all the force is coming from. If you ever did our Training Your Eye course, we had that spotlight. And wherever that spotlight is shining, that is where the effort is. So I'm going to bring Carly in here just now, and I'm going to show you exactly what muscles are working, when, where, and how, and why the glutes are not necessary, so that it makes sense. So, I want you to think of this. Anybody can be in a plank position and squeeze their glutes. We can all do that, because we're actively going to squeeze your glutes. This is great for people who say, you shouldn't be thinking about it and it doesn't matter because it automatically happens, or you don't have to think about a muscle to contract it, or it's not possible. Well, when you're in a plank and you squeeze your glute, it's possible. So that's also not true. So when we lift out of the shoulders, I want you to tell me if you say that the glutes are active in a plank, which they're not, they're totally soft, jelly, relaxed. That would mean it's the same position but with bent knees, that the glutes are active here, which they're not. I want you to think to yourself, what would keep me up? Where's the effort? The effort is in the front of the body. It's got nothing to do with this. And we've got stability happening here. We've actually got quadriceps straightening our knees because gravity wants to break this joint. But the quads are saying, don't break the joint, extend the knee please. So we get that quad work happening. But if I drop down, what am I in now? I'm now in hip extension. So what am I doing to get myself to this point? What's changing? The hip joint is going from hip extension to hip flexion, but stopping at that neutral position. So there's no effort required from the back. When we say we're asking our clients to contract the glutes, you're not doing it to keep them up or to hold the position. You're giving them an easy way out to maintain the position of the pubic symphysis by saying to them, use your glutes, they're bigger and easier to fire, and hoping that when you're walking, you're not thinking of constantly squeezing your glutes to maintain the position of your pubic symphysis. So, what we're trying to teach our clients to do, because we're trying to get this stronger in a plank. A plank is not for this. A plank is for everything in the front. If I reverse it, a plank is for everything at the back. But when I'm over here, I want to teach them that abdominals, especially rectus abdominis, that is attached onto that pubic symphysis, can actually pull that pubic bone through instead of finding your usual way, tucking your pelvis, squeezing your glutes. There's a whole different reason why we don't always do that, because it restricts hip dissociation, free movement inside the hip, when you constantly squeeze your glutes for a posterior pelvic tilt, especially in an exercise like this. So when you're over there and you extend out and they arch, you can either squeeze the glutes, which could give you that, or you could activate abdominals and still have pretty much no glute activation whatsoever. I can then decide in my brain, yes, I think I'll just give the glutes a squeeze as well because I want to. Somebody mentioned turning the legs out. So turning the legs out in a plank would be a little bit strange because the medial part of the knee would take a lot of strain. If you really want somebody to activate glutes, you put a tone loop around mid-calf, you have them open their legs out, and there they'll be activating glutes, but not because they're tucking through, because they're actually doing abduction with their legs, and therefore the glutes will kick in. But then, when you anchor your feet on the floor and it's not that active pulling out or that closed chain pull out, it also doesn't allow it to work as much as you want. However, when you're in a plank position and I now decide to lift one leg off, then obviously my hip extensors are going to kick in. Otherwise I can't get my leg off the floor. Yes, then we're looking at glutes and hamstrings, but here's the thing. Probably mainly hamstrings, because that knee is straight. Hammies doesn't have the job of actually bending the knee. So therefore it says glutes, you know, you're never really that great. So I'm going to lift this leg, probably most of it, and you can do your little bit that you're used to doing. So whenever you start raising body parts off of a mat, then yes, you will get a different biomechanic happening within the body, different muscles kicking in different ways, because it's not that closed chain standard plank. But when you're trying to understand a plank, we need to understand where the body is, where gravity is, what is anchored on the floor, and where the effort is coming from. So, Carly's going to come in here. Let's break it down a little bit further. In this position, to hold her here, she's obviously got her knees bent, so she's resting on her knees. She's lifting out of her shoulders, so yes, we're getting good shoulder work, we're getting serratus, and I always want them to just get that feeling of pulling that head back. Abdominals are going to hold onto that pubic symphysis to stop her back from dropping. I don't need to tell her to squeeze her glutes to do that, because that's not functional. If I ask her to stand up and walk out of the room, she can't be squeezing the glutes and walking out like that. She has to have like a little bit of activation from somewhere else. We're trying to get people to alleviate lower back irritation, pain, niggling. That study that we released earlier, where we did that report on pelvic tilts and pain, one of the things in there was speaking about how they found that activating the lower abdominal area to control the pelvis helped these people with their lower back discomfort. That was amazing. We were like, yeah, we've been teaching that all along. One tick for us. So, she's got her abs holding the pubic symphysis because it is attached there. If I ask her to hover her knees just off the mat, nothing changed. So what actually lifted her off of the mat? Now I want you to think, what joint changed here? I want you to look at her knee flexion when she's down, and then look at her knee flexion when she lifts up. It lessens. So that means that's quadriceps that just lifted her off there. A little bit of anterior deltoid work, because there might have been a change in the shoulder. So there was no glutes, but she's lifted off. If I ask her to extend her right leg back, left leg back, hold. Here, I can take Carly's glutes, I hope she doesn't mind, and I can give them a nice little squeeze and a jiggle. They're nice and relaxed. She doesn't need them to hold this position. It doesn't mean that we're trying to weaken them. We're just looking at the biomechanics and trying to understand that asking your client to contract glutes here is not going to help them stay up in a plank. When I see that they start arching their back, I'm trying to encourage them to lift out of the shoulders, pull the pubic bone through by pulling it towards the rib cage with the use of the abs and keeping this soft. Because I'm trying to train the brain to find the abdominals to control the anterior pelvis. That will help whenever you're teaching hip flexor abdominal coordination, hip dissociation, and functional movement, important for sport. If Carly then goes and arches her back, and I'll ask her to squeeze her bum, she'll squeeze her bum, but I'm not teaching her how to actually hold onto this. So, put your knees down before you dive. So, giving the correction of activate your glutes or tuck your pelvis through using your glutes is just eliminating yet again the fact that we're trying to teach people to activate this area, which we all struggle with on a daily basis because we don't know how and we don't know where. But it's totally possible. And once they get that control, they can do exercises like lying on your back, legs up to 90 degrees, extending them both to 45. Because I taught them how to activate the abdominal area to control the pelvis in a plank. Now they can use that same sensation to control the pelvis here when they get that leg or both legs out to 45, and we're testing hip flexor abdominal coordination. So when you're on your hands and knees and you're going into that plank, I want you to think of what would stop her from dropping to the floor. If glutes are hip extensors, take your legs back again, would they not then extend your hip? That's hip extension, taking her down. So what takes you back up? You've got to do hip flexion. So I'm getting that neutral length of the hip flexors to maintain a plank position, and the effort is in hip flexors, quadriceps maintaining those straight knees, abdominals maintaining the pubic symphysis, serratus anterior maintaining scapular stability, anterior deltoids maintaining shoulder flexion, and we're getting a little bit of work here. And she's staying here, and it's getting harder and it's getting harder, and I still don't see any glutes. Why are you coming down? She's like, okay, that's enough, Tanya. So the moral of this whole video today is you can use a muscle when you don't even need it. You can squeeze it because you want to. When it's getting really tough, or maybe they're tight in their hip flexors and they're struggling with abs, you can ask them for a little squeeze there if that's going to help them. But what is the final result at the end of the day? We don't want them to have to do the glute. I would rather take the legs back again, have her pelvis a bit higher, and here get the abs to pull through. Because now I'm training her how I'm going to get her lower and lower and lower into that plank. Then have her up here where her hip flexors are too tight, ask her to squeeze her bum through and then lower her body down. I don't want to do that. I'm trying to train her to get to that good position with the use of the abs. So have them higher, because let's say hip flexors are tight. Tuck them through with the abs over here, and that is going to be of more value to them when they start doing other exercises that you don't even know the abs are helping them with in a plank. On your elbows, please. Now we make the plank more challenging. Somebody was saying something about plank on a ball. It's not the same thing, because plank on a ball has the ball that's moving all over the place, and you'll get hip abductors and hip adductors trying to keep the ball in. When we're looking at a standard plank, feet planted on the floor, closed chain, without lifting a leg up, you do not need those glutes. You are also not going to strengthen your glutes here unless you start lifting that leg up and giving it some serious resistance. The effort is in the front of the body. I've never had anybody doing a normal plank, not lifting body parts off, and saying, whoa, my glutes are on fire. No, my abs and my shoulders. Oh my word. I was just working with a rugby player now, and we actually did this. And he sat up and he was like, my shoulders and my abs are dying. He didn't mention his glutes once. And he should have, because just before the plank, I had done a whole series of trying to get him into glute med and max, because he has a TFL issue on that left leg. So he had some serious glute awakening already, and he didn't feel glutes in the plank at all. And I was looking at his plank, and he was planking good, and I was getting serratus firing, abs firing, and those glutes were not working to hold him in the plank. So she's over here now. What makes this different is she's going to be lower, so it's going to become more challenging. So we say, when it becomes more challenging, don't we use the glutes? So she's over there, she's going to extend the one leg back, other leg back. Nice and soft, not working. Abs holding, yes, this is what we want to teach our clients to do. If they can't do it, we lift them, we tuck them, because then the hip flexors aren't getting so much stretch. But when she's in that good position, head back, chin in, no need, until she lifts the leg up. You can even see it. There's the peach. So much better. Place it down, relax. Do you feel it? So I hope that makes sense. If you have any questions, you're welcome to comment on here. You're welcome to pop us an email. You're welcome to pop us a private message if you feel like you don't want anybody to see your question, which you should never ever be afraid of. Just say what you want to say. And let's break this down a little bit better. Let's understand biomechanics and muscles of basic exercises a little bit better before we even dive into variations. Take care.